First of all, welcome to the class. Because you know what? During the lecture, you will be taking a lot of notes. And if you guys have downloaded the handout and printed it out, you will see that not everything is there yet, right? Try to cover until the middle part of your nutrition or until water soluble or fat soluble vitamins. Okay. But you know what? No matter what exam you are going to be taking, we are going to be
Mhm.
covering everything for RN and LPN. If you're wondering, Professor, wouldn't it be kind of weird for an LPN to take this review together with RNs and vice versa? Actually, it's not because the coverage of the exam for the LPN and the RN are almost the same. Almost the same. The difference are just the percentages of certain topics. For example, LPNs as compared to RNs have more delegation type percentage, like they have 2% more for that type of questions versus the RN. So there's no need for it to be a separate class. Plus, we will be pointing out things. For example, if there's something that is specifically for RN or is specifically for LPN, we are going to be pointing those out as well. But anyway, we are all nurses. So, of course, what's the number one thing that nurses do? We do assessment, right? Lots and lots of assessment. Every day there's going to be assessment. And the number one assessment we take are the assessment for your vital signs. Vital signs. Why? Well, look at the name, vital signs. Vital signs are the signs of life. The signs of life, meaning whatever condition the client may have or whatever is going on in the client's body is usually reflected by the vital signs. It's the first thing we assess, the first thing we check to see if there is something bad going on with the client. Or sometimes we also assess it to check how the client is responding to to prescription, to medications, right? So by the way, we are not going to be tackling it super in depth, but we are going to be pointing out the most important things for you guys to remember. And talking about the concept or talking about the progression of things, we have a lot of practice question. So usually what we have is for each concept or for each topic, we start with a practice question or an introduction of a practice question. But we are not going to answer it yet. We are going to answer it after the discussion of the concept. The reason why this practice question is shown in front of you is for you to have an idea how this specific concept could be asked in your exam or how it would come up or might come up in your exam. So for example, in here, vital signs, right? Question, example question. Which statement about taking vital signs requires a need for further training if heard by the nurse from a UAP? So by the way, UAPs are the unlicensed assisted personnel or the patient care technicians, right? So they are under both the LPN and the RN. So of course, both the LPN and the RN needs to know what are okay and not okay to be done by the UAP. What procedures, what responsibilities are okay for the UAP. And we also need to know what things cannot be delegated for a UAP or would be wrong if delegated or done by a UAP. So in the context of vital signs, not only do we need to know the normal vital signs, we also need to know what things to look out for and what things or what specific vital signs um, um, are danger signs. So we will tackle all of that in the following slides. So we will not answer this yet, okay? Because we will answer this later. Just note that questions like this can come up in your exam. So talking about the vital signs, what are the vital signs? So we have different ones. First, we have temperature or the body temperature. What else? We also have the pulse rate, the respiratory rate, the blood pressure, and pain. By the way, in your handout, there are blanks. And if you're having a difficulty um, uh, filling out the blanks, just note that if something is red on the slides, for example, this one, it's red, right? This one is red, this one is red. Those are blanks in your handout. So it's going to be a bit easier for you to follow and also to note which ones are missing information in your handout. So again, vital signs are the signs of life. They show us or inform us if the client is getting better or not getting better, if the client is responding to treatment or responding to medications. So what are the important things to remember here? First, we have the factors affecting your vital signs. This is a favorite, by the way, in your SATA questions. What is SATA or what are SATA questions? SATA are the select all that apply questions. So either they ask you this in SATA, meaning you just pick which factors are affecting vital signs, but sometimes they ask more in-depth questions. More in-depth questions means that they would ask you what is the factor and why is it important? Or for example, what factor is affecting the vital sign and how it affects the vital signs. So not only do we need to know all the factors, we also need to know how it affects the vital signs. And again, if it is read in the slides, it is blank in your handout. So let's talk about all of these things one by one, okay? So first, the age. It says here, extremes of age typically mean regulation issues. So what do we mean by extremes of age? Well, youngest and oldest, right? Or youngest and oldest. The younger the person is, the more difficult it is for them to regulate their body temperature. So who is a young person? For example, an infant. An infant would have difficulty keeping themselves warm, right? What else? An elderly person. If some of you are working in a nursing home, what do you notice? Elderly people sometimes don't know if it's too cold or sometimes they don't know if it's warm, right? So as nurses, it is our responsibility to check temperatures for them and then address whatever is going on accordingly, right? So drugs and smoking. So drugs are medications, prescription, or sometimes illicit substances. So for example, CNS depressants and CNS stimulant. So when we say CNS, it means central nervous system. So if something is a CNS depressant, it is a sedative, right? Or a downer. If something is a CNS stimulant, it is an upper, right? So of course, those medications can increase or decrease the vital signs as well as your smoking. What else can change the vital signs? Exercise. Exercise, not just exercise, let's also add activity. Activity. So if there is an increase in activity or in exercise, there would be an increase in the utilization of energy, meaning there would be an increase in the basal metabolic rate. Therefore, there's also going to be an increase in the vital signs. Therefore, if a client came in from the outside or just came in to the clinic, what do? We wait for 15 to 30 minutes after exercise, after activity, or after they had been out before getting the vital signs because we want to avoid getting a pulse reading. Of course, as much as possible, we want to get accurate, very accurate results because the vital signs are going to be the basis from which doctors will base their therapies, their prescriptions, and so on, right? How about meals? Well, if you've noticed, if you've eaten something very hot or very spicy, what's going to happen? You start perspiring. You start feeling hot. What else? Sometimes you also palpitate a little bit, right? Or there will be an increase in your vital signs. Now, sex. Well, of course, sex, the act itself, as well as the gender, can affect the vital signs. If you've noticed, males are typically warmer than females. They have a higher body temperature because males have more body mass or muscle mass compared to females, right? And also the body mass as well, which retains heat. So they have higher temperature. Now, since males have higher temperature, it also means they have a higher metabolic rate. If you have a higher metabolic rate, of course, you will also have a higher pulse rate, a higher respiratory rate, and so on. How about the site of measurement? So for example, if you've noticed, there are different sites for taking the temperature, right? For example, we have the tympanic, we have the oral, we have the axillary temperature. What else? For the pulses, we have the brachial, we have the radial, we have the carotid, and so on. So the different sites of measurement can give a slight differences in the vital signs, and that is normal. Okay, Professor, what is considered normal? Well, if the deviation is only just 5 or less, for example, if you got the pulse here, it's 81, for example, and then you got the pulse here, it's 79, so it's less than 5. It's not a big difference, so it is normal. But if there's a big difference between the vital signs with the different sites, it could mean that there is an impairment, um, either in the circulation or something else, right? Depending on what specific vital sign is being taken. Now, how about stress and or illness? The more a person does not feel good, for example, they are stressed, they are in pain, they are upset, they are emotional, anything negative, then the higher their vital signs usually would be. And that is why when we take vital signs, sometimes we also take nursing notes, right? We add, for example, if the client is emotional, if the client is having certain other factors, we note those things because those things are the factors that affect the vital signs. And last but not the least, we have the time of day. So when you wake up in the morning, you had been getting up from a rested state, right? Because you're sleeping. So your vital signs is typically a bit lower in the morning. Then when you get up, you start doing activities, right? When you start doing activities, of course, you produce heat. And to produce heat, you exert more energy, more power. So your vital signs are also gonna increase. Temperature is gonna increase because you produce heat. To produce the heat, you need to fuel it. So your respi is going to increase, your pulse rate is going to increase. So these are important things to consider. And that is why if you've noticed, when we are taking baseline vital signs, usually we take them in the morning, right? We want to take it in the morning before the client is stressed, before the client has gone through their day, before things have happened. Because we want to take the most accurate baseline vital signs. So these are your vital signs. And again, I know this is so boring for maybe a lot of you, but these are very, very important topics. And that's the problem, you know. A lot of times when we do assessment for the students, they are really good with the difficult topics. But ask them the basic questions and they don't get a good score in that. And that is something that we've also seen because I'm part of a certain group of nurses that are reviewing curriculums for different schools. So what we see usually is students are having a difficult time with the basics. Those are the things that are failing them. And according to the latest NCSBN statistics, meaning the test results, latest test result statistics, people are failing the NCLEX not because they don't know the difficult topics. It's because they don't know the fundamentals or the basics. So hopefully that would not be the case for you. It would be so sad, right? For you to be a nurse and to fail in the easy topics. Okay, so for the temperature. Temperature is the balance between heat production and heat loss. You don't need to memorize this, by the way. These are just definitions. What you do need to memorize are the different methods or the routes of temperature or the most common sites for taking the temperature. So we have the oral. Oral is just the mouth, right? Mouth. Axillary would be the axilla, the armpit. Rectal, wait, armpit. Rectal would be the anus or anal area. And we have the tympanic, which would be the ear. So, Professor, do we need to memorize everything? You don't need to memorize everything, but I'm going to point out specific things. By the way, update in your NCLEX. So, because you're going to be taking the NGN version of the NCLEX, around 25% of your questions would be NGN format, 20 to 25%. The good news about that is in NGN format questions, the normal ranges are already mentioned. They provide you with the normal ranges. So you don't really need to memorize as much. But there's also a bad news because, of course, you will still retain about 70 to 75% of the usual NCLEX format questions, which means that you still kind of need to at least know the ranges or be familiar with them. You don't need to memorize the exact values, but you need to be kind of familiar with them. Now I'm gonna just add certain things that might come up in your exam. What is the most common or easiest way to take the temperature? The most common usually would be oral. That was in the old concept. But now what we usually use is the tympanic. Okay? So for the people, I don't know what year you have graduated. I know sometimes we have a mixed group wherein some students are graduates just weeks ago, and some people are graduates from like years and years ago. So for the benefit of everyone, I'm going to be mentioning old concept and new concept so that there would be no confusion, right? So old concept, the most common would be oral, but newer concept, we use the tympanic because it's easier to assess the tympanic, right? What else? So for axillary and rectal, what might come up in here is that what would be the best route for assessing the temperature of a newborn? Would it be oral, axillary, rectal, or tympanic? If the kid is a newborn, usually we want to assess via the rectal route or the anal area. Why? You are doing two things. First, you are assessing the temperature. Second, you are also checking for possible imperforate anus. Checking for possible imperforate anus. Professor, I'm scared to do that because what if the thermometer breaks? It's a glass thermometer. By the way, using glass thermometer is old concept. We do have digital thermometers now, so it's not gonna break, right? It's made of plastic with a probe on the tip, so it's not gonna break. So it's okay to use for the newborn. So you're checking the temperature and you're also checking for possible imperforate anus. So what else are important in here? Okay, professor, why not use the oral or axillary for the newborn? A newborn cannot really stop what they're doing, or they don't have the volition yet to follow directions, right? For example, you can't tell a newborn keep the thermometer in your mouth, or don't move around when the thermometer is in your armpit. Of course, they cannot do that, right? So the easiest for us nurses would be to do the rectal. So these are possible things that might come up in your exam. Now, for the pulse rate is also your the rate of the heart's contraction, the rate of the heart contraction, or the number of beats per minute, right? So if you've noticed, pulse rate is also what you call this measured in BPM. BPM equals beats per minute because it measures the what? It measures the contraction or the number of the heart's contraction per minute, right? So what are important things to remember in here? Again, you do not need to memorize everything. You just need to know the key concepts. So if you've noticed here, what goes on is that as a person ages from newborn to adult, their heart rate kind of slows down, right? So it's normal for newborn to have a higher degree of or a higher amount or number or value of beats per minute as compared to an adult. The things that you need to really memorize are just the newborn and the adult, especially the adult, because checking the pulse rate is important in giving certain medications. What else? In assessing an adult client's response to therapy or treatment. So those are important things. Other things that might come up in your exam are the pulse sites. So you don't need to copy this. All of this is in your handout. Right? So we have the temporal. Temporal is at the sides of your forehead. We have the carotid over here. Right? We have the apical. Apex would be heart. What else? We have the brachial. We have the radial, femoral, posterior, tibial, popliteal, and pedal. What's important to remember in here is that, okay, professor, I remember a question wherein I was asked, why is it that the doctor is checking the brachial artery, the brachial pulse, and then also checking the pedal pulse? Why is it that they are checking the pulse rate in the upper extremity and the lower extremity? What's the reason for that? Why not just take one? Okay, so in some clients, there are conditions wherein there's an impediment or an impairment in the circulation in the lower extremities. So for the doctors to be able to assess that, what they do is to check pulse rate in upper extremity and pulse rate in lower extremity, and then compare the values. So for example, your pulse rate in the brachial is, for example, 94, right? And then in your pedal, it is 84. There's a huge difference. It's more than 5. So it means that possibly your lower extremity is not getting enough tissue perfusion or not getting enough blood. And then they can now perform more invasive exams or more invasive tests like an MRI, right? So they check the pulse rate first before prescribing other tests. So those are possible things that might come up in the exam. Other things that might come up in the exam in here is, why is it important? Why is it important to what is the most common and most acceptable site to check the pulse of your client? Would it be temporal, carotid, apical, brachial, radial, femoral? Well, the most acceptable or the easiest one would be the radial, which is why we use it, right? Radial, which is why we use it. Why? So in nursing, we have different clients. Sometimes we have clients from different cultures and different religions, right? In some religions or cultures, you are actually not allowed to touch certain people, especially if they are the opposite sex, right? So in the event of an emergency, the most acceptable way for you to check the pulse would be the radial, because it's the least sexual or the most respectful. Professor, but why is it that when a client is unconscious or when they are gonna be needing CPR, why is it that we check the carotid? If the client needs CPR, it means their heart already stopped or is near stopping. So trying to assess via the radial, usually you would have a difficult time assessing it, or there would not be any pulse anymore, really, right? So the easiest way for you to check without any instrument at all would be the carotid. And since it's nearer to the heart, if the heart is still working, even when it's working only faintly, you would still be able to feel the carotid pulse. And that's why it is the one check when you are trying to do CPR for the client. So those are the possible things that might come up. So if you've noticed, questions are not really basic, right? It's not really easy. It has like a deeper meaning, or it's not really fundamentals. It's actually more of interdisciplinary or intertopic question already. For example, with the different sites, it's just vital signs, but they are actually checking for transcultural nursing concepts, or sometimes they are checking for emergency nursing concepts, right? That's how it's going to be asked in the exam. Things look easy, but they are actually not. So another vital sign we check is the respiratory rate. So respiratory rate, respiratory rate can be BPM. It can also be CPM. So what is BPM? BPM is breaths, right? Per minute. And CPM is your cycles per minute. So both of these pertains to your respiratory rate. So do not be confused if you see CPM, BPM, right? At least now you know it's just the respiratory rate. So important thing to remember in here is your normal rate of respiration for your client, which would be 12 to 20 in an adult client, right? Other things we check are the depth, the rhythm, quality, and character. I'm not going to be focusing in this topic right now because we are also going to be covering it for respiratory nursing. Now, what you need to be familiar with are the common assessment terminologies, because these are what you will see in the exam. So when you say you, when you see the word you or the prefix you, EU, it means normal. So eupnea is normal breathing. Pnea is breathing. Eupnea, normal breathing. Brady is slow. Pnea is breathing. So bradypnea is slow breathing. Sometimes in the exam, the assessment are kind of hidden, wherein they do not really mention any vital signs. They just use assessment terminologies, right? And then they ask you, can this client be given medication or something like that? You need to know and be and have open eyes for this terminology so that you will be able to point them out or to consider them when picking a correct response for your exam. Now, for tachypnea, tachy is fast, right? Pnea is breathing. So tachypnea is fast breathing. But not just fast, it is also rapid, meaning fast, but shallow. So if you're wondering, Professor, what's the difference between tachypnea and hyperventilation? Are they not the same? So tachypnea is fast breathing, but it is shallow. In hyperventilation, it is also fast breathing. Fast breathing is rapid rate of breathing, right? But in hyperventilation, the breathing is deep. Now, why is that important? Once you go to fluids and electrolytes and also ABG analysis, how deep or how shallow the breathing could be important assessment parameters. Also, when trying to pick the most correct response, keywords are very important. I know right now it doesn't seem as important, but as we go on in the review, I will point them out so you will see how important they are. Now, hypoventilation, slow and shallow breathing. Hypo is slow or low, right? Dyspnea is difficulty or painful. Dyspnea is difficulty of breathing. And of course, if you're having difficulty of breathing, you're having discomfort, which can be transcribed as pain, right? Orthopnea is difficulty of breathing when laying down. Chine-Stokes is the gradual increase and decrease of respiration followed by period of apnea. We will discuss more of this as well as give examples during our respiratory nursing. And apnea, when you see the prefix followed by keywords like nea, it means absence or the non-presence of. So is absence, nea is breathing. So apnea is absence of breathing. So these are the common assessment terminologies.
Hey nurses, are you studying for the NCLEX? Are you tired of failing the NCLEX? Are you frustrated that you've taken the NCLEX so many times and failed before? Listen, my name is Dr. Adesina. I will help over 10,000 nurses pass their NCLEX on their very next attempt. Matter of fact, they call me the NCLEX doctor. Listen, I'm going to show you the secret strategies that I've used to train over 10,000 nurses to pass their NCLEX on their very next attempt. Listen, all you need to do right now is click to get inside access to my free training where I'm going to show you step by step on how to pass your NCLEX on your very next attempt. Listen, I know you feel like the NCLEX is challenges. You don't understand the fundamentals. You don't understand critical care. You don't understand neurology. Listen, all that's going to be history. I'm going to show you how to pass your NCLEX on your very next attempt. It's so simple. Click the link right now to get inside access to my free NCLEX training where I'm going to show you the exactly blueprint. And plus, I'm going to give you bonus questions that you're going to see on your NCLEX exam. All you need to do right now is click the link, get access to my free training, and I'm going to be emailing you those free bonuses. Click the link right now, and I will help you pass your NCLEX on your very next attempt. As a matter of fact, I want you to be a nurse. I want you to start practicing nursing in the next few years so you can take care of patients in the hospital and do what you truly love. If you're ready to pass your NCLEX, click the link, and I'll see you in the future training.